name is Laura. I'm going to be your nurse today. Do you mind just giving me your name and date of birth before we get started?
It's Amber Hinken, 9/10/1996.
Nice to meet you, Amber. That's exactly what I needed.
Okay.
So today we're just going to learn how to take your pulse while being prescribed on a beta blocker. So I have a few questions I need to ask you before we get started. The first thing is I just want to assess what your learning style is so that we can make this appointment effective for you.
Okay.
So there's actually 3 types. You have the visual learner, you have an auditory learner, and then you have a kinesthetic learner. The visual learner, people who like to learn visually really like, handwritten instructions or written instructions as well as diagrams and pictures. Auditory learners like to learn through discussions. They also like to learn through verbal instructions as well. And then kinesthetic learners really enjoy hands-on learning. They learn best through that. So which type of style do you think you best fall under?
I would say I'm a mixture between the visual learner and the kinesthetic learner.
Okay, so I will definitely make note of that. Something else I want to make sure is, are you in school by any chance? Do you go to college?
Yes, I'm in my first semester of nursing school right now.
Okay, do you enjoy what you're reading in school right now?
Yeah, I do. We're learning about the phases of the nursing process right now.
Okay, well that's really neat. I remember when I was in my first semester of nursing school and I learned about the 5 phases of the nursing process. It's pretty lengthy.
Yes.
So that's neat. And another question I have to ask is, how's your day going? Are you feeling any anxiety or?
My day is going pretty good. I'm not feeling any anxiety. I'm just pretty eager to learn how to take my pulse and read it at home.
Okay, so you're not feeling any emotional or physical pain right now?
No.
Okay, good. So I'm glad to hear that you're pretty eager to go ahead and learn about taking your pulse. So by the end of this appointment, you will be able to demonstrate how to palpate your pulse while being prescribed on a beta blocker. You will also explain why you need to palpate your pulse and assess it at home while being prescribed on a beta blocker. And you will be able to describe the 3 ways needed to be able to palpate and assess your pulse accurately.
Okay.
Okay?
Okay.
All right, so we'll get started. The first thing we're going to do is we're just going to learn how to palpate your pulse. So I actually have a diagram here that I drew. And this is actually called your radial pulse that you're going to be monitoring.
Okay.
So I drew a hand here, and this black arrow shows where exactly you want to palpate it. So you're going to take your pointer finger and your middle finger, and you're going to gently press on the inside portion of your wrist on the thumb side. All right? And you should feel, your heartbeat. Okay? So why don't you go ahead and try that for me?
Okay. It feels strong and regular to me.
Okay, very, very good. So you mastered that skill, very good. So the reason why you actually have to monitor your heart rate whenever you get home is because beta blockers can actually slow down your heart rate. And they do this by actually blocking the release of certain hormones in your body like adrenaline, and it slows down the flow of blood throughout your entire body. All right, okay. So that's why we need to make sure that you monitor that. I actually have a brochure here for you, and it's actually going to tell you all the different things you need to know about your heart health while being on a beta blocker.
Okay, that's very interesting, but how do I make sure that I'm reading it accurately?
Okay, so there are actually 3 ways that you can make sure that you're accurately monitoring your pulse. The first 2 ways actually just have to do with while you're assessing your radial pulse. So you're going to start out by assessing the pulse, and then from there you're going to see if it's regular or irregular. If you feel pretty regular rhythm, that means that you have a regular pulse, and all you have to do is count it for 30 seconds and multiply it by 2. If you have an irregular pulse, it's not going to be a regular rhythm, and you will count it for an entire minute, okay? And that will be your pulse. The third way to do it is you can actually use a portable pulse ox just like this, and it's just going to go on your finger just like that, and you will get your pulse rate and you'll actually get your oxygen level.
That's pretty cool.
So yeah, this is something you can easily get at Walmart or Walgreens, any place like that, and it's a super easy way to accurately get it.
Okay, good deal.
Okay, so do you have any questions for me yet?
I don't think so.
Okay. All right. So let's just go over all the information that we've gone over. Amber, do me a favor and just show me how you would palpate your pulse and what are the 3 ways that you can accurately monitor it.
Okay, so I would start by using the inner portion of my wrist on the thumb side. I would use my pointer and middle finger, and I would palpate for my pulse and check to see that it is regular. And if it is regular, then I count it for 30 seconds and multiply that by 2. And if it happens to be irregular, I'll have to count it for a full minute. And then I can also use that pulse ox.
Exactly. So that was great. I'm glad you learned all of that information. Do you remember why we need to take your pulse in the first place while being on a beta blocker?
Beta blockers tend to slow down the force at which blood is pumped through the body, and that can result in decreasing the heart rate.
Good, good. So we always want to make sure that your heart rate isn't too slow when you're at home, because then you can run into some conflicts. And so that's really good. You have successfully learned all of the learning objectives that we went over today.
Okay.
I do not have any changes that I want to make to all the skills that you've learned. You did it all very accurately and perfect. Do you have any questions?
I do not.
Good,
Thank you.
Good. You're welcome. It was all appropriately done, and you did a good job, Amber, okay?
Thanks.
You are welcome. I hope you have a great day.
You too.
Good.